Good day, fellow learners. This is your mentor, your fact check buddy, joining you from the Gapuz Review System Building here in UN Avenue, Manila, Philippines. So, as our logo would show, we are now celebrating our 30 years. And the number 3 is very significant for us because we started with 3 students way back in 1994. And now we're serving nurses from 33 different countries. You got it right. So I'd like to share with you guys the pointers for this set. And this is our set number 31. Okay. So I'd like to highlight some important things, specifically those things which I know you may not have focused on, especially in terms of the details, because sometimes we have the tendency to hurry up our preparations, and then eventually we miss on some details that are being asked on the test. So this session is intended to correct those gaps or our inability to focus on those concepts which we think doesn't matter, but actually it matters, okay? Which we think don't matter, but actually it matters. So let's begin with the first set of pointers. And you always begin with a question when you're studying. And the first question that you have to ask yourself is, what do I need to study? What do I need to focus on? So if you have this kind of question in your mind, the most important intervention that you can initially implement is to ask for an expert advice. But one thing I'd like to share with you is when you're seeking expert advice, you make sure that the expert you're asking from really has a good grasp of what the NGN is all about. So that simply means they are supposed to be passers of the test. You cannot rely on someone who did not pass the test to give you an overview of what you need to study for the test. It's like a blind person leading another blind. So in order for you to correct that, let me be your expert friend at this point in time. Okay? So the first and most important thing that you have to focus on for this set would be the use of cane. Now, remember, there are things that we have to study when we are recalling some concepts related to cane. And this would include the concept of where should it be held. Remember, it should be held on the unaffected side. Or sometimes they reword that, it should be held on the stronger side. Now, the next question that we have is, how lengthy should be the cane? So if you would notice, we have here a picture, okay? And the first picture, that's going to be to your left, okay? If you are facing your computers right now properly. So you would notice that the appropriate length of the cane should be measured in relation to the creases of your wrist if your hands are freely hanging over your side of your body. So that simply means the height of the cane should be up to the wrist creases, okay? But you make sure you don't raise your wrist like this, okay? You let your hands hang to your side and then take the measurement from the floor to the area of the wrist, okay? Now, another important thing, if that could be reworded, is that the height of the cane should be up to the level of the greater trochanter, okay, of the hip. And it's not as if you hold onto your cane with your arms outstretched. If you would notice the second picture, okay, we now have the man in a suit, okay, you would notice that there's a slight flexing of the elbows, and the flexion should be at 20 to 30 degrees, okay, to hold the cane properly. So the most important thing to tell your patient who is using a cane is to hold it opposite the side that needs support, or on the stronger side, or on the unaffected side. So for example, okay, if the right leg is injured, hold the cane in your left hand. If the left leg is injured, hold the cane in your right hand. So it's always the opposite of where the injury is. Now, what are the common indications for the use of cane? So this is usually utilized by elderly clients, especially if they have problems related to maintaining their balance. This is also utilized when there's an injury or problem in terms of weakness and stability. And another concern of clients in relation to the use of cane is how are they going to move it when they're going up the stairs and when they're going down the stairs, especially if they need to hold on to the side rail. So to climb upstairs, what do we instruct the patient? Place the cane on the side of your good leg, okay? And then with your free hand, hold onto the handrail or the side rails. Then step up on the good leg, followed by your injured leg. So when you're going up, good to heaven, okay, so the good leg first before the bad leg. Once again, place the cane on the side of your good leg, and then with your free hand, hold onto the side rails, and then move or step up on your good leg, followed by your bad leg. Okay, good to heaven, that's the code. Now, when you're going down the stairs, what do you do? Remember, bad to hell. So, but you don't move the bad leg ahead of the cane. You need the cane for support. So when you're going down, the cane first, followed by the bad leg or the injured leg on the step, and then the good leg on the step. So remember, good to heaven, bad to hell. Okay, so let's move on. I hope you are remembering those concepts. Now, let me share with you the success stories of this group of nurses. There are actually 7 of them, but one was hurrying up to go home. So let me read what Rene Rose Alvarez D. Laban has sent me. Okay, good morning, Sir Ray. Sharing you our picture taken last June 28 to 30, quick fix face-to-face. USRNs na po kami lahat. So what she's saying is all of them passed the NCLEX RN. Insert rin po si Brian Delen na nagmamadaling umuwi kaya hindi na pasama dyan. So what she said is that Brian Dillon's not in the picture because he's hurrying up to go home. Forever grateful to you, Sir Ray, all of the mentors during our online review, and the whole Gapuz team as well. You have played a big part in our success in becoming USRNs. God bless you. My pleasure to have served you in making your great American dream a reality. So these are all of them after their crowning moment. And if you would notice on the pictures below, you get to see the flocks of nurses attending my classes in the Philippines. So be one among our thousands of passers from around the world, including, this is a very nice story, a 60-year-old woman who passed the next generation NCLEX. And all of these passers have come to our system, okay? Now, the second most important thing that I'd like to highlight for this set of pointers would be your halo vest traction. Now, pay particular attention. Halo is the one on the head, like a halo, and of course, the vest. Okay. Now, halo vest traction is usually indicated when there is an injury to the upper spinal cord, okay, or spinal column. So, one of those things that you have to focus on when your patient has a halo vest traction is what are the most significant things that the patient should know upon discharge. So, in essence, you have to learn how to give discharge instruction. Okay? Now, let's describe what a halo vest traction is. If you notice, you have the halo, okay, around the head, and you have 4 posts held in place by screw. And of course, this is attached to the vest, okay? Now, the head is usually supported by the halo and the post. So, which means this prevents further damage into the spine, specifically the neck area. Okay, now, What do we need to instruct the patient upon discharge? We have to instruct the patient that they need to check these areas daily. For the halo areas, you'll have to instruct the client to check on the pin sides. A clear discharge could be expected, therefore it's not a cause for alarm. However, if you have pus-like foul-smelling discharge, then that could be a sign of infection and that needs to be reported to the healthcare provider. Aside from that, also instruct the client to focus on the area here, okay, over the shoulders. Skin sores would usually form on those areas. So it's very important that we have to instruct the patient that if there are blisters that are forming, then they need to call their physician. Now, can they take a bath? So these are the things that they need to modify. First and foremost, we instruct them not to use soap when they are trying to wash themselves. Avoid the use of powder or cornstarch and even lotion, especially under the vest, as this can irritate the skin. Now, what can be used then? Water and hydrogen peroxide can actually be used for skincare, and pay particular attention to the fact that when the vest is being cleaned, it just had to be wiped with a damp cloth. Remember, it's not a wet cloth. It should be damp. Okay? So what happens when the pads, if you would notice the pads get wet, so you can ask the client to use the blow dryer, but make sure that it's in the setting of cold, okay? So that they don't get irritated by the hot air that comes out of the blower. So it should be in the cool or cold setting. Now, can clients take a shower? No. But can they take a tub bath? Yes, but they need a lot of help in getting into the tub, and you make sure that there's only like 1 to 2 inches of water in the tub, okay? Now, when they need to shampoo their hair, you have to first and foremost apply Vaseline petroleum Vaseline petroleum gel, okay, on the area of the screw insertion sites. That is to prevent water from entering the areas. And then you have to wipe it off after shampooing the client's hair. Now, what is expected in their next visit to the physician? X-ray would usually be done to check on the healing. And if you would notice, there's a part here where you have the yellow buttons. This is where the wrench, it's not shown here, should be placed, okay? Now, the wrench is needed just in case the halo vest needs to be removed for an emergency procedure, like, for example, cardiopulmonary resuscitation. So you use the wrench to remove it, okay? So ensure that the wrench is always taped in front of the vest. Do not remove it in front, okay? So these are the things that you have to focus on when you are taking care of a client with halo vest traction. Okay, now let's pay particular attention to the 3-point crutch gait. So but before that, let me just highlight 2 things, okay? First, on the picture on your left, the crutch tips in relation to the foot marks, or the shoe mark rather, okay? So lateral to the small toes, you have to have 6 inches, okay, in terms of the position of the tip of the crutch, and then 6 inches lateral and 2 inches forward. So that makes it a total of 8 inches. 6 inches lateral, 2 inch forward. So that's how you have to provide instruction on how the patient should begin positioning themselves in relation to the crutch. And then when they're doing the 3-point gait, okay, what do we instruct the patient? Take a look at the picture to your right. So first, okay, from the beginning position, you have to instruct the patient to move both crutches first, okay, and then they need to shift the weight on the palm of the hand, okay, and then move the affected leg, okay, affected leg, and then the unaffected leg. Now, take note that the axillary bar should be 2 to 3 inches below the axilla to prevent nerve damage, okay? So pay particular attention to the fact that the patient should have strong upper extremities in order to use the crutches. So if they would want exercises, you need to refer them to the physical therapist. And if they have problems in terms of the grab bars, okay, across the crutches, so you have to refer them to an occupational therapist who would assist them for their fine motor skills. Okay, so with these functional concepts that we learned, is it enough to pass the NGN? Remember, I had one student who told me that, Dr. Ray, I have the right answer in my mind. But when I did your simulation, it's as if I have difficulty navigating through the questions using the mouse. So which simply means passing the NGN requires more than just knowing your concepts. So in essence, you have to learn how to study with technology. And here at the Ray Gapuz system, we have all sorts of technology, including our textbook, so which is available at Amazon. Okay, of course, you have your NCLEX RN in a Flash, published by Jones and Bartlett USA. And I asked them, what book helped you the most? And they answered 311, especially the key points in the book. Okay, so we also have our course shells. If you would want an anytime, anywhere access to the Ray Gapuz learning tools, the course shell is the way to do it. And most importantly, you need to attend my quick fix, and that should be done in a conducive environment. Here at the Ray Gapuz system, we're the only one with our own simulation laboratory for the NGN, together with a very, very conducive atmosphere for teaching and learning. So may I invite you now to join me and avail of our NCLEX RN Flex, the most flexible test prep class for the NCLEX RN. Now, this package begins at $3,499. That's less than $100, okay? And it includes your choice of live face-to-face class, virtual class, on-demand and limited video recorded lessons, QBank, and 3 books. Remember, the way to learn and to pass NGN is to focus on functional concepts and learn how to navigate technology. So once again, this is your mentor, your fact check buddy, Ray Gapuz, saying thank you and see you in my next video.